can then finish this presentation with another question for our panel that is important for the implementation. And maybe we start from the scientist, from Michael. In your view, what is the most important and most urgent issue that we have to tackle? And then I will ask the same question to all the people in the panel.
Okay. I will try. First of all, we've got 3 domains which should be addressed equally: basic research, clinics, healthcare, and social. Because we are burning on each of these sections. They're very urgent. So there shouldn't be any advantage to one to the other. They are interlinked because, of course, finding just disease-slowing treatment for 5 years would yield billions in savings, and not speaking about quality of life and burden to the families. Then, from the point of research, what I feel, and JPND could be this place where we could discuss results in such a way that they will be not judged who said, but what was said. And then confidence of the industry will come back as well to support our research, our work. Because when I follow, then of course I will not speak names and etc., but I can see many projects which industry is funding and were proposed by people who never done research, and they have no record of anything doing in Alzheimer's disease or neurodegeneration. And this happens. And of course, outcome of such a trial is failure. So how many failure can in this way industry withstand? So that's a very important point. Let's say when we talk, and now we are building nice groups in JPND, where we openly speak, for example, I'm in a group of animal models. Well, we set up reverse paradigm. I'm not building a model where I'm trying to find something similar to Alzheimer's disease. I studied in detail pathology and mechanism of the neurodegeneration in human brain, and I'm building a model and trying to look how many what I found in human brain I can find in animal model. And this valuation can yield model when I use in my preclinical efficacy studies to tell me, yes, there is a guarantee it should work to some extent. And I think this is where we have to be fair to ourselves and to create and describe our work this way. This is my feeling, personal feeling, and my personal belief.
Okay, thank you very much. Marcelis.
I would like to make a distinction between the long term and the short term. And in general speaking, politicians are mostly interested in the short term. And in my country, we realize that. I work for them. It's not a disqualification. But I think a very important advice is that those 2 pillars are both important. Please pay attention in the short term, and I mean that is how to improve the quality of life, how to improve the social care, how to improve the health care. That's the main discussion in my country at the moment. And if you put those 2 pillars equally, then I think there is also enough room for put money in the long term for the long term. For instance, the Ministry of Innovation in my country put all the money on research together and defined 5 main topic areas for research, and healthcare is one of those. And I think, and public-private partnership is also an important issue in that. So I think that if you pay attention on the short term, there is always room for the long term, and I think that is very important to get in the political area. Enough support for these programs.
I think your advice is extremely wise.
Thank you.
And you are absolutely right. Thomas.
I think short term, if we're speaking in the next 2 to 3 years, we ideally would like to see a successful phase 3 clinical trial for Alzheimer's disease, at least to confirm that the pathophysiology that many of these compounds are targeting is validated or not. Because this could have significant impact on how pharma will approach the disease. I think we also need to better understand why clinical trials have failed. This is also a way to plan for success. There are some initiatives that have launched the sharing of clinical trial data, but clearly it's not enough. We have to better understand from the failure in order to better interpret the approaches that are going to be successful. I think there's a lot of work to be done in that area.
Certainly, absolutely. Jean.
Well, I think that the 3 pillars that have been identified by the JPND, which is cause, cure and care, are the right ones. And I'm not here to advocate a kind of shift from the funding from the aspects of cause and cure to care, but I really want to see additional funding that should be made available in the sector of care. I think we're all hoping to have symptomatic treatment, or to have better treatment, to have effective treatment for all the conditions that are studied by the JPND. But we also really need to find answers to people that are affected by the disease now, and any kind of social research that can look into how to improve, in a way, the pathway from a patient and a carer from early symptoms to diagnosis, to care, to treatment, to end of life. All of that, I think, is really an area that almost is a new frontier that we really need to identify additional funding for at this stage.
Thank you. Yeah.
Well, the state of the art in psychosocial interventions is that there is not one single intervention which is effective to everyone. It should fit the patient. So we should go for patient-centered interventions, and this is a large methodological challenge. And so we should have a lot of interventions available which can be used in specific patients. And we also should know why interventions and randomized control find effects or not. So we should use mixed methods to know what is really happening in a randomized control trial. And if you go for patient-centered interventions and you want to have better intervention, then it's easy to make a bridge with biological sciences, because you can really look at the condition of the patient and the brain condition of the patients, and you can focus on intervention. So I think that we haven't done this so far, but I think this is really a major challenge. And also making a bridge to categories, so you can have each single patient, but you can also look at phases in the process. So you can look at what need patients in the beginning of the disease and later on in the disease. So we have a lot of things to do to give really patient-centered interventions, and we need outcomes which are able to measure these patient-centered interventions. So there are a lot of challenges ahead.
Okay, a lot of things to do, so we have to start working.